you said, thank you for that intro. I've been working in Chinese medicine supporting women for the last 10 years. I am a trained acupuncturist. I've also got a few other bits and pieces I'm trained in. I'm a reflexologist. It's the first thing I did. And also I'm a trained herbalist. But my background prior to that is marketing and money broking and all sorts of life-changing, life-stimulating things. So I haven't always been a healer, but the greyer you go, the sadder you look and the more wise people think you are. So I'm going with that look. And as you say, I've always worked with women. I much prefer working with women, that you have what they call, is it the fifth sign or something? When you're working with them, their periods give you so much more information than so much anything else. So I've always found it more easy to work with them, plus the fact that, there's a synergy there because I am a woman. And I treat women I support them with their fertility, I treat them through their pregnancy, so I can turn babies, which is kind of nuts, and menopause, pain, and cancer patients, so supporting them through their cancer treatment. And as you said, one of the things that's really tough for cancer patients is that they don't have the gradual ebb away of their hormones. They have a very, I want to say cliff face, but that makes it sound really awful and really scary. And actually what menopause is all about is being positive. So it's not a scary thing because there's things that can help you, but it is very different to natural menopause. So there's a whole sort of raft of that. And some of my patients they were having such bad hot flushes trying to come and see me at clinic. And my best friend got diagnosed with breast cancer, became menopausal myself. I just thought being in the four walls of my clinic, even though I had 2 rooms to work between, was really restricting what I know to be a very powerful medicine, Chinese medicine. So I searched around to find something that I could take, wider than just my clinic room. And what I found was there wasn't really a great deal of proven products out there. And I found that none of them particularly beautiful. And I know that might sound a little bit superficial, but actually, why wouldn't you want something that looks lovely? Because lovely things make you feel nice. Like being out in beautiful nature makes you feel nice. And there certainly isn't anything out there, product-wise, as global as I hope to be, which really relies heavily on the wonderful medicine that is Chinese medicine, which is incidentally the most used medicine in the whole world and one of the oldest medicines in the whole world. Well, if you think about it, it's from China. So along with a few other things that we're not going to talk about. So, and the other thing that you notice when you start delving into the world of menopause is that the world is really constructed on the white male, whatever you call it. I don't know what's the word. It's written down here somewhere, but now I'm not even on my notes. I don't know what I'm talking about. No, it's the white male construct, isn't it? So, anyone that's read Invisible Women, which is an awesome book. Really brilliant book. It just tells you how the world is designed around men, even down to like your transport to work. Sorry, I'll go off on one of this, but and toilets, how toilets are designed for men much better. And I saw a wonderful thing on somebody's Insta post the other day in the menopause community about how come we know how to keep men hard for 16 hours, but we still don't know how to sort out hot flushes. It's just that epitomizes all for me. Everything is male orientated. And what happens there is that because it's, the world is very male, what we're experiencing as women becomes almost, it becomes invisible. It becomes shaming. I mean, I'm seeing loads of posts in various communities of women saying, is anyone else ashamed to say they can't manage in the way that they used to be able to? And there's a taboo around it, and it's silence. And so one of the things that my co-founder Nikki and I want from what we're doing is it's not just a product. I want a whole range of Chinese medical products because I know that they can work and help, but we also want to create community where we can bust the taboo by breaking that silence. And we're happy to bust the taboo for everybody else. Not everyone else has to bust it. It's like we don't brand any of our none of our packaging is branded because we're really comfortable with what Menopoised is, but not everybody wants the world to know, and that's all good. We'll do the shouting, but we want to be there to support women. So what happened was let's try and cut that story a bit shorter. So I looked around and I did some training, and I came across this idea that you could use a magnet placed on an acupuncture point for clearing heat, for hot flushes and night sweats. So I started using it in my clinic, and then I did a trial last year, and the data was analysed for us by Sussex Innovation Centre, part of Sussex Uni, and found that 80% of women were getting benefit. Wow. In terms of reduction of intensity and frequency of their flushes and night sweats, which when I went to see an innovator in London at the British Library, and I was telling her about this, and he said, well, 8 out of 10, he said, if it was just 1 out of 10, then I think it was an amazing product, which made me go, wow, okay, A, this is awesome, and B, really? Are there products out there that only work for 1 out of 10 women?
Well, just so many medicines, I think, as well.
Well, and that's the thing that nobody talks about as well, the fact that, you know, there is that expectation that all medicine works for people. And I guess privileged as I am to have a self-selecting group of women that eventually believe in acupuncture. They may not when they come to me, but hopefully they do when I finish with them. But yeah, it's cultural. Gosh, there's so much to say, isn't there? There's the cultural piece of it, and this trusting and handing over of your health, and having your health segmented into small pieces, which is so very opposite from Chinese medicine, which is all about, I'm not a big fan of the word holistic, but it is a good word to describe it. Everyone is, you know, that your health is like a jigsaw, and we're putting it together and we're looking at the whole piece. We're not just going, oh, you've broken your leg, have a cast, or you don't feel great in the head, you see a psychiatrist, because all of it is interconnected. You can't separate it.
It's so true. In fact, I do an exercise both with my one-to-one clients, but also with a membership group, where we look at cross different areas of their life and get them to give a score. And it's not just about sort of energy, rest, movement, nourishment, and then sometimes we look at a sense of purpose, and as well as mental and physical resilient, like how well you feel about stuff. And then when you give yourself a score, that's where you can see where you're misaligned and where you might want to focus for that month on that particular area. So that's what you want to do.
That's fascinating. And what would be really interesting to do with that is to overlay the elements. So when I talk about elements in Chinese medicine, there's lots of different types of acupuncture, and there's lots of different lenses through which you can look at people using Chinese medicine. But one of them is the 5 elements. And so you just talked there about motivation and that kind of thing. And I know immediately where they might be out of balance there, because if you're lacking motivation and energy, it could be your kidneys that need a bit of support. So
brilliant. Well, that was perfectly on to Chinese medicine, and the idea of these 5 elements, and how it's about creating balance in this holistic way. Can you just talk me through those 5 elements?
I can do that. I'll try and do it as succinctly and easily to understand as I can. So essentially, they're in a circle, and you have the element that we always depict as at the top is fire. And fire is about creativity. It's to do with the heart. It's to do with joy, and the sound of it is laughter. So we have these correspondences. Oh, wow. Which aren't just, as I say, they're not just, what's happening in the body physically, but they're to do with other energies like emotions. That's one of the things I love about Chinese medicine, is when you start talking about the organs, they almost become like people to you, because you know what their job is. So one of the jobs of the heart in the fire element is it houses the emperor, and the emperor must always be calm. He must always be sitting on his cushion, drinking a cup of tea, doing his stuff. And he has everyone else do his bidding, but he's always got to be calm. If he's not calm, then the rest of the body is out of kilter. And the heart, as we know, is the main organ for the body. So the fire is really, really important. Yeah. And then as you come around the circle, the fire feeds the earth. And actually, as you can see in nature, the fire can feed the earth. It certainly has an effect on the earth. And so the earth is related to the stomach and the spleen. Mostly we would talk about digestion and nourishment, but we're not just talking about food and water, and the dog is beginning to snore now. I'm not that boring, I hope. but so the earth can relate to mothering, can relate to nourishing, it can relate to, you know, your feet being on the earth. It can have so many connotations. And one of the,
again, I talk about nourishment rather than nutrition.
yeah,
Because I feel like it's wider than that.
Well, we were saying just before we started that I'm just coming up with this new way of positioning Chinese medicine from a menopause perspective. And the 4 key tenets for me are mind, body, nourishment, and what's the other one? Oh, she's got it written down. Restore. Yes. Restore. Yes. Oh, we're talking the same language.
Rest is like my themes. The themes in my membership are rest, nourishment, and movement. So very fantastic. I don't know much about Chinese medicine, but it sounds like I'm quite aligned.
I think you're very aligned. So you've got earth, and I'll just rattle around them, and then you come into no, it's great. Earth goes into metal, and obviously metal comes from the earth, so that kind of makes a bit of sense. And metal is one of the elements that I'm can't say least fond of, because I care about them all equally as my children, but I'm sort of least, I don't know, I never really spot it or see it, but it relates to the lungs, and it relates to the colon, so it relates to, you know, inhale, exhale, taking stuff in, excreting stuff out. It also relates to the skin, and its emotion is grief. So yeah, maybe that's one of the reasons. Yeah, I don't know. I have to think about that, why I'm not so fond of metal. Might be because it's a bit.
That's all ways in which we let go of stuff as well, isn't it?
Yes.
Letting go of toxins or sweat or
exactly, excretion, exactly that. And the other thing that's really interesting about metal is that it contracts and expands. So that might be a reason why I'm not particularly fond of metal, because what I'm learning about myself, because I'm having quite a bit of coaching at the moment. Well, I've been having coaching for the last year, and it's been actually it's transformed me, and it's transformed the business, because it's just enabled me to get in the arena, as Brené Brown says.
Yeah.
But maybe I don't really like metal, because I'm learning I don't like being constrained, because I think I've got quite a lot of earth, which is this colour is earth, symbolises earth, but also I've got quite a lot of fire, which is creativity. So I think that's why I don't like metal, because it's too constraining. And then you come down to water, and water is kind of the seat of everything. It's absolutely critical for life. It's the seat of our fertility. It's the seat of our constitution. It's represented in our organs by our kidneys and our bladder. And the kidneys, so all the organs have quite different. Did I see a penny drop then?
No, it's really interesting, like in terms of hormone change, and some women experience so many bladder infections.
Yes.
Well. And we were talking about water and aging again before we came on.
Yeah. So I was looking at the 4 what is called commonly symptoms, but as I prefer to say, issues related to menopause. You know, there's a whole stream of them, and to be really honest, it's, you know, if you read those, you could be just as frightened as you would be if you read all the cautions on Western medicine. But who does that? And I find it's better not to worry about what they all are, because then you're sort of questioning how you're getting them. Yeah, but like you said, there's a lot to do with water, and we can talk more about water later. But so water is fed by metal, and then water feeds wood, and of course water feeds wood. What do trees need to grow? Obviously, they need the light from the fire, which is also, we talk about heaven and earth, not literally, but that's a lot of Chinese medicine is very it's very nature based. It's very, what's the word? This is menopause. I never remember my words. It's you know, when you use pictures to describe, I can't think what the word is, but you know, we use rivers and seas and all this to describe the meridians and the flow of energy. Anyway, so that's water. What else? What's the thing? Water is fear. That's the emotion related to water. Yeah. Now she's getting it.
This is why this is so important.
Yeah. So water then feeds wood. That's what I was saying. And so wood's really interesting. I do love wood. wood is all about free flow in the body. So really important to move, but to move appropriately. And again, that's another thing through menopause. Yeah, that and it's something I've learned the hard way. I do love to spin. But I don't, obviously, I haven't been able to during lockdown. And what I found actually, well, and what I know, not found, but I know to be true, is that doing restorative exercise is far better for me than you know, pushing myself around on a bike in a gym. Maybe go outside and do it. But yeah, so, but water, oh no, I'm on wood, aren't I? Sorry, I could talk about water forever. So wood is about free flow. So wherever you have pain in your body, that's an issue to do with wood. Wood represents the muscles and the tendons. And so if you're feeling stiff and unable to move properly, you've most likely got some kind of wood imbalance. And wood people are quite interesting and easy to spot because they're usually quite wiry and thin, and they usually really need to do everything, and they're quite quick, but they, you know, and they need their gym and they need the exercise. And part of that is that the water is feeding their wood, because they need all the adrenaline from the water to get the wood moving, and they have to, you know, all of this. And then coming back around again, the wood feeds the
feeds fire.
Yeah. One thing just to say before I won't go into this in any detail at all, but there is that's the kind of nourishing cycle, but there's also another cycle called the co-cycle, which is the controlling or punishing cycle. So and also it can be, you can call it the relationship between the husband and the wife. When they're feeding, it's the mother and the child. When it's controlling, it's the husband and the wife. So the wood can control the earth. It can, I mean, that's the typical manifestation of that in terms of illness would be something like IBS, because it's stress. Anything related to stress manifests through wood. Anything related to overworking and overdoing is manifested through water. But so yes, yeah. And so yes, you've got this control cycle as well. So if you want to control fire, for example, on your cycle, you would use water, because the line in the circle goes up from water to fire, and that makes sense as well, doesn't it? Because you can put fire out with water. And then fire controls metal. Well, yes, fire can control metal because it can make it expand, turn the fire on and off, and you can have an impact. And then metal can control wood, which is perhaps why I don't like the metal, because the metal is constraining and the wood wants to move. And the wood controls the earth, as I say, which is can be a bit of a bugger, because they all have their personalities. And what wood tends to do is if it's allowed to be out of control, it will go off and over control everybody. It will just go mad. But it goes into the earth first, and that can be quite hard digestively and in other ways. So that's it. I hope that made sense. But you can see, and this was a medicine that was, you know, it's thousands of years old, and yet they knew where all the organs were in the body without seeing inside, and they knew what the various organs did. It's just remarkable.
Really fascinating. Absolutely fascinating. Said I've long been intrigued by it, but just not had the nudge, I suppose, to go and have a look. It sounds like I would find lots of this quite exciting in terms of actually how I look at the and I'm sure some of the things that I've studied and read anyway are quite strongly influenced by this. And increasingly. So we were talking again just before we came about water feels really relevant, doesn't it? It feels really like, as you said, that there was lots of light bulbs as you were talking about water, thinking about fertility, constitution, kidneys and bladder, that those are things that, so, and overworking and overdoing, which is a common, quite common in many women in their 40s. And then also think about fear. I mean, it could be that it's fear of aging, it can be a fear of change, and the idea that we end up overworking and overdoing in order to try and kind of mitigate that fear.
Oh, that's so true. Yeah. It's so true.
So really interesting. So if we were, you're going to talk a little bit about water and aging.
Yeah, totally.
I'm just going to talk about water. I'm going to have a sip.
Good girl. I'll come on to that. One of the things actually that just crossed my mind as you were saying that was, making the conversation about aging is so vital, because that's all we're talking about. It's nothing more complicated than that. Obviously, the world that we live in is, I would often have patients in clinic saying, "Oh no, I'm not really stressed," and I'd know from their pulse that they were stressed. Yeah. And it's, really, I challenge anybody to walk outside, particularly now. I mean, all things COVID aside, but the world is stressful anyway, just because of the number of messages we're getting. If that's all, the advertising, it's kind of designed to be stressful in a way, isn't it? But what I was going to say was about creativity. So the fire element is the creative element. And obviously, one of the most known issues with menopause is hot flashes and night sweats. And it's just a question of fire not being regulated in a way. But fire being creativity, I know fire isn't the seat of fertility, but what you find as you age and you lose your childbearing fertility is that you come into a new type of fertility, a new creativity, a new space, and a new power in a way. It's almost like you're shedding the responsibility of having kids. And I know we're not generally as we come into peri and menopause, because we've got kids and we've got elders generally. But there becomes this new space inside you, and I've definitely personally experienced that. I've stopped drinking alcohol for 3 years. I'm going through a divorce, and all these various things. But through that, there has been the most incredible feeling of power, which has brought menopause to life. So it's, don't be frightened of that change, because it's like moving house. I'll come out with analogies till I'm blue in the face, but it is like moving house. When you're moving house and you feel like, oh, I don't really want to let go of my old house, because memories, and I love it there, and I know where I am with it, until you find the new house that you couldn't live without, in which case the old house is all done. Forget that, I'm moving on. But you don't know what the new house is going to be like till you're there, till you see it. And that's a little bit what the aging is like, isn't it? It sounds terrifying, but actually it's bloody awesome. So do you want to have a word in edgeways? It's your
no, go.
Let her go. Okay, so one of the core principles of Menopoised, in terms of Chinese medicine, is this whole principle. In Chinese, it's called Yang Shen. And translated, that means nourishment of life, or more succinctly, live well, live long. And the whole cultural thing with aging is so different in the East to how it is in the West. Older people are revered, and women certainly aren't hung out to dry in a way they feel they are in the West. And that could possibly come back to the invisible women thing, which, so this whole nourishment of life. So the way I like to explain it is, it's like you are like your favorite comfortable chair. You need 4 pillars, 4 legs on your chair, and they all work together. One is not more important than the other. They're all part of the same structure, and if one is out of kilter, the other one will be too. So nothing is discrete in as much as it all blends in. And in Chinese medicine, we talk about qi, which is energy, which doesn't float everyone's boat, so I don't really go into it too much. But basically, it means everything is interrelated, as we talked about the elements and everything else. And so one of the legs on the chair for us is the mind, and one of the legs on the chair is the body. And I wouldn't normally separate the mind and the body, because I think they're interrelated. Well, I know they're hugely related. But in terms of expressing those 2 different sides of us, I like to have them as the 2 different legs. And then the other 2 legs are nourishment and restoration. And actually, I can put those in elemental form, which is just so bloody exciting. So you've got to look after your chair, and you've got to make sure that all of the legs are working in order to be able to sit in it and be comfortable and get the best use out of it. And if you relate that back to your body and go, if I look after my body, I'm going to get the best use of it. Live well, live long. So the sweet spot is really when all 4 things are achieved, which, let's not set ourselves out to be perfect, but we can strive for these things, can't we? And work towards it. So how they all relate to, I'm just looking at a couple of notes here. In the Western Hemisphere, there are 34 recognised issues relating to menopause, to the mind and the body and surrounding menopause. But there's a couple of notes I wanted to make clear, is that menopausal issues are different in the West to the East, as I mentioned. The second is, I say the mind and the body, and I believe that a lot of menopausal issues are culturally appropriated. And by that I mean it's not just about chemical imbalance. It's, you know, we did some research with women who were, they're actually called geriatric mums, which is very tongue-in-cheek, older mothers. And a lot of them were actually already having perimenopausal symptoms, but they weren't aware of them. And that could just be a change in your periods, right? It doesn't, you know, and it doesn't matter, again, it doesn't matter what you call it. That's the other thing that drives me a bit nuts. You don't need to have an explanation, a word for it to understand it. And the last thing that we've said a few times, but it's just so important to me, is that we don't, and I will do it when I slip up from time to time, but we don't talk about symptoms. We talk about issues, because menopause isn't a disease. It doesn't need medicalizing. It's something that's totally natural, and it is aging. And I absolutely have, I need to make it clear as well, I have absolutely no beef at all with Western medicine, Western doctors, you know, the use of hormones for women, because we should have choice, and that's what this is about. But my passion is doing things naturally, which is why I do what I do. But one interesting point about HRT is that it's only called HRT here. In America, it's called HT, because it's hormone therapy. It shouldn't be hormone replacement therapy, because what we're replacing is stuff that our body, well, not that it doesn't need, but it's naturally changing. So just a very brief note on biology as well, because I think it's always really helpful to sort of set the scene, so people can really, some of this, when I learned some of this, it just absolutely blew my mind. So menopause is caused, basically menopause is the day that you haven't had a period for 12 months.
One day.
Sorry?
It's just one day, menopause.
It's just one day, and I think we should be having a birthday, not a birthday, having a menopause celebration. Yeah, totally. Lots of chocolate. I don't need an excuse for that. And prior to that, perimenopause, you know, it can vary wildly between women, but you know, it's kind of 3-4 years. It's probably happening to women and they don't even know it's happening. And again, who cares? Doesn't really matter, does it? What, you know, as long as you're looking after yourself. So it's one day, and then after that, you're postmenopausal, and that's really difficult with me, I find, with the language of, are you perimenopausal, are you menopausal? Oh, I didn't realise that. So it's just, everything's changing. And the reason it happens is because you're born with this finite number of eggs, and your eggs and your ovaries are the main bearer of estrogen. Well, your fertile estrogen, there's 3 types of estrogen, but I won't go into it. So your fertile estrogen, so when you run out of eggs, you run out of that kind of estrogen, and then your adrenal glands take over. Now, your adrenal glands in Chinese medicine are to do with the water element, because they sit on top of the kidneys. So it makes sense, doesn't it, when we talked about the water element and overworking. If you overwork, you're running on your adrenaline, so you're depleting your water. And water, you know, is the seat of fertility. It's the seat of what we call Jing, Jing, and that is like it translates as essence. And eventually your essence runs out, and that's okay, and that's normal. It's like a candle, eventually it burns out and we die, and that is natural and normal. So it's really important to know that none of this that's happening is abnormal. It's what should be happening, and not to be fearful of it, because it's just all part of the rich tapestry and the cycle. So this change of estrogen, the estrogen that you produce in your adrenal glands isn't as strong as the estrogen that you produce in your ovaries. And it's kind of got a different vibe to it. And one of the things that blows my mind entirely is that there are 400 uses of estrogen in the body in 300 different places. So when you're no longer producing that estrogen, no wonder you're going to feel slightly different. And no wonder it's taxing on your body. So coming back to the Chinese medicine and the water side of things, it's really important to look at the things we can do to take care of it. And as I've mentioned, overwork is really detrimental. Lack of sleep is detrimental as well. So, you know, for people who are doing night working, you can, I mean, I can think of patients, a male fertility patient of mine who gets up at 3 o'clock in the morning. You know, his fertility is on the floor, and that's partly because he's not getting the chance to restore his thing.
Sleep,
yeah. Stress is detrimental. I mean, mostly stress affects wood, but if wood's out of balance, then it's going to steal from water. Drugs aren't particularly good for water either, and fear is quite a big one. Now, water also in the body rules over certain things, and I may not have all of them because I'm not a textbook, but your bones relate to water, and that kind of makes sense to me. Your bone marrow in the head, we call it marrow. The brain is marrow, and I don't know if you know this, but the brain is 80% water. So again, weren't they clever that they knew that the brain and water had this relationship. Head hair. So if you see someone with great hair, you tend to know they've got quite good kidney energy. It cools. Actually, there's two different types of kidney energy. So I'm kind of, which are quite distinctly different, but I'm kind of picking the ones that are aligned with estrogen, just so that I'm clear. Because if any acupuncturist is watching, they'll go, that's not true. But I'm aligning with estrogen. And it moisturizes as well. And you'll know if your kidney energy is good because you will feel motivated. I used to have I treat women, but it's all the guys I'm remembering tonight. One guy come and I was treating him for fertility, so it was always a back treatment he had, and he would go, can you stick one in for I've got a big presentation, I just need to be focused. So that's kidneys, you know, determination and focus. So we'd stick a needle in for that, and he'd be like, I've done the best presentation because you boosted my kidneys. If you've got imbalance with your water and there's kind of too much of it going on, it can cause issues with your blood vessels. It can cause rigidity in your joints, in your muscles. It can cause lack of sweat and lack of urine. I know that sounds the wrong way round, but trust me, that can be the case. It can then affect your sleep. It can affect your digestion. It's related to libido, issues with the back and the spine. It balances fire, as we mentioned. It feeds wood and it draws on metal. So 5 key ways of looking after your water as you're aging. And the first one is not really very surprising. It's drink more water. Some of these sound so simple.
But I was talking about it to somebody today. Like, it's just so powerful. Cheers.
Because if you don't, you can end up with lack of mental clarity. You can end up with stress, headaches, fatigue. You know, you can make yourself, in fact, beginning of lockdown, I ended up in an ambulance and going to hospital because I got severe heat stroke.
Wow.
And it knocked me out for 2 weeks. I don't think that was the full story. It wasn't COVID, but that was being dehydrated because it was so hot and it had been hot for a long time, and I like being outside. So severely dehydrated, it wasn't clever. And how much water should you drink is a good question. And this is something I learned the other day. Patients, I never drink enough, which might be true, but actually how much is enough? And it is determinant on your size. There's an equation for it, which I've got written here, but it's like, oh my God, that's really... So if you weigh 60 kilograms, you should be drinking about 2 litres. But if you weigh more, then you should be drinking more. So if you're tiny, you know, just drink what you need. Just have to be that set 2 litres. So the other thing that water is really important for, I mean, it makes sense from a Chinese medicine perspective as well, is thinking about its moisturizing function, is it can improve your skin, your hair, your nails. And one of the things that often happens during menopause is the vaginal lining gets very dry. So it can help with vaginal dryness and your intestinal lining. So everything, we are mostly water, aren't we? We need lubrication. So drink water would be my number one. And sorry, it's so simple, but actually often patients say to me, well, what else can I do? And I think, do you know what? That's probably enough. If you could make that one change, that would be awesome. Keeping stress on the low down is another really important one, because when you're stressed, you're using up your adrenal energy. And remember from Western medicine that your adrenal glands are making your estrogen for you. Yeah. And sort of related to this, but not another separate point. There's this whole thing about putting on weight when you're menopausal, and actually there's some really good physiological reasons for that. And you need to be neither too fat nor too thin, but your body is using your fat to help you it's storing and making estrogen. So love your fat, be kind to it, and don't try and banish it completely, because you do need some, because if you don't have enough, you'll have trouble with your menopause. And again, so mirrored in my work with fertility patients. Of course it is, because it's hormones, but so many women I see with fertility issues are struggling because they're over exercising. And you have to have balance. It's one of the key things in Chinese medicine. So back to the stress. When you're stressed, you're overburdening your adrenal glands, and you're not helping them at all create that menopausal estrogen that you need. And in Chinese medicine, that's affecting the wood. And if the wood's out of balance, it's going to draw on the water. So to look after the water, take care of the wood, if that's making any sense. I mentioned this briefly earlier, but the restorative exercise piece is really important. So in Chinese medicine, water relates to the bones, and we know that osteoporosis can become an issue as we age, and it's certainly one of the things in terms of HRT that doctors would say it's good to protect against osteoporosis. And I'm not disputing that, but what I am saying is that I think there's lots of other ways we can look after our bones. And restorative exercise is one of them. Weight-bearing exercises, you know all of this, but that's another one. That's a really important one. So add that to the list of things that are desperately important to do. Banishing heat I've put, because one of our key things that we do in Menopoise, this product, our main heroine product, as we like to describe her, is for clearing heat. And so that's kind of the first focus that we have in terms of the menopausal issues that we're working on. But my God, I've got a list of products I want to launch. Everyone's holding me back.
My little box is upstairs somewhere. Have you got a sample?
I've got hundreds of them everywhere. Coming up my ears.
Because they are beautiful, like tiny gold magnets.
I think the thing for me when I'm starting this up, I started with the brand because as I mentioned earlier, I have experience in marketing, but because there was nothing out there that looked nice, and because I also realised that Chinese medicine wouldn't be for everybody, you kind of need to get past that with something that looks beautiful. So they're the tiny magnets, and you can see by my finger there that they are very, very small, and they're very discreet.
Little tiny plaster, put them on the back of
the neck. Yeah, it's so discreet and it's so easy to do. And women are saying
one way in which you can banish heat.
Yeah, but the thing I was going to say was, before it turned into a sales message, was that I think I mentioned it earlier as well, is that water balances heat.
Yeah.
So and the Chinese just brilliantly knew that if the fire was out of kilter, you need to put water on it. So if you strengthen the water, by strengthening water, you are supporting the heat.
And that makes absolutely perfect sense in terms of where that heat might come from, because you're not controlling wood. Wood is part,
and
working and stressed and fear as well also means adrenaline. All of that pulls on the adrenals. So from a Western medicine perspective, you're going to prioritize the production of cortisol over the production of estrogen and progesterone. And then you're going to end up out of balance. So Chinese medicine, amazing, knew that naturally 2,000 years before anyone else.
And absolutely. And the last piece, and you've just said it for me, one of the most important things is talking, because fear can cause for problems in itself. I don't know if you've heard that. I was listening on the radio, they were saying about statins and saying that actually they do work, but the reason why they're causing problems for people is the fear around statins is what's causing it, not statins.
There was research recently, wasn't there, about that?
And I can't even go there in terms of that, because that's like saying, I mean, it's just Sorry, it's just so arse about face, and it's sorry, blatantly in my world not true. But anyhow, back to this. Talking, so important. So being part of a community, and being able to ask questions that you want to ask, because we were saying at the beginning, this invisibility problem, and the fact that the world isn't designed for women has made us, has pushed us down. I mean, who hasn't gone to the toilet with a tampon shoved up their jumper? Yeah. Because they didn't want people to know that they were bleeding. And it's not the nicest of things, but we all women do it. And let's not be icky about it, because if we're icky about it, then the other half of the population is going to be. So talk, don't be fearful. Don't be fearful. Talk. And that's, I mean, there's so much. And by the way, it's not you. It will pass. You will age. You will get to the other side. And we forget this. Menopause is just like, for those women who've had babies. For those that haven't, hopefully you can understand the analogy, that when you're first pregnant, you don't focus on the birth. You focus on being first pregnant, and you can only deal with the bits of pregnancy as they come up. And actually that happens so much, to the point where often you give birth, because that's at the end what you focused on, that you end up with this lump and you don't actually know what to do with it, because you didn't think past that. But menopause is the same. It's just take it as it comes, take each step and figure it out as it goes. Can I just say one more thing? Sorry, it's just about the Western medicine. I'm hard to shut up. But one of the other thing about Western medicine, for women who aren't there yet, is there's a lot of, the doctor won't give me a test for this, and how do I find out if I am? Well, unless you think it could be a serious health problem, then join a community is probably going to help you more to feel better about it, because doctors have 3.5 hours training in their medical training about menopause, so they don't know a great deal. And B, in their NICE guidelines, there's restrictions on what they can and can't test.
No, I didn't know. She was a doctor who was a menopause specialist. She came to I used to do these live Feel Good 40s workshops that she came to, because she wanted to look at the whole package and not hormones, and that was amazing.
That is brilliant. I mean, we have doctors recommending the magnet, and my cancer patients are referred to by an oncologist who also recommends, and I've got chemo nurses wearing them. Can you imagine what it was like as a chemo nurse through goodness knows what it's like now, but certainly the first lockdown and all that PPE. And so I was handing them out like sweets to people, because you've got to support people however you can. But anyway, I do talk a lot. I hope that was helpful.
Well, I found this absolutely fascinating. Thank you so much. I am I've seen so many parallels with the things that I've learned over the last few years, that I now want to go and delve into understanding more about Chinese medicine, but also how well the things that you've said about supporting that water element, supporting aging. I love it. I'm loving this idea of seeing perimenopause, menopause as a process that everyone goes through, because it's part of aging. Aging is natural. Aging is something that you go through. You come out the other end, and you can support yourself well through it by really simple things like drinking more water and managing your stress levels, which is not always that easy.
No. Exactly. I throw these things out. There's loads of tools to do that. I'm not suggesting any of it's easy necessarily, but there's loads of tools that you can use.
But actually, some of those other things, the restorative exercise, time out in nature, help with balancing cortisol levels as well. So, and the idea about talking and being more visible, and what you and I do is to try and do more of that anyway. So thank you so much, and thank you also. Jo sent me a pack of the Menopoised magnets that I'm going to give away in my workshop on Friday evening as well, to one lucky participant. And I don't tend to get hot flushes, apart from I get them in the night in the week before my period. So I'm trying out the magnets for the kind of for that week, just to see what a difference that makes.
Brilliant.
Because I'm intrigued by it.
You can definitely take it on and off. That's really, it's a really interesting thing. So women do that. I had a text the other day from someone saying, I put it on. I had really bad hot flushes at night sweats, and I was really worried. And then I woke up and I found the magnet was wrapped up in all my sheet. And that's why I was like, oh, thank God, it's still working. That's good.
It's still working. It's still working. All right, then. Thank you ever so much, Jo.
No worries, my pleasure.
It's been so brilliant having you here. And thank you to those who listened.
Thank you.
Bye.
Bye.
Right, so I have stopped. I'm going to stop that.